Hello, my name is Fatma. This is my portfolio video for Nurse 701 Primary Care 1. My topic I'm going to be discussing is I have a URI, do I need antibiotics? I'm going to be discussing what an upper respiratory infection is, how to prevent an upper respiratory infection, how to manage an upper respiratory infection, and whether or not you're going to need antibiotics to treat this. So first things first, what is an upper respiratory infection? An upper respiratory infection is also called a URI or the common cold. It's caused by a virus. Some of the symptoms people may experience are congestion, coughing, sneezing, sore throat, feeling achy all over, even a low-grade fever. Some of these symptoms may last for 3 to 10 days. So that's the lifetime of this virus. So it's very important to educate that these symptoms may last for the whole 10 days. And I also have a picture on the right side that is showing some of the symptoms that people may experience while having this virus. So how can someone prevent getting a URI or an upper respiratory infection? So the first thing is washing your hands. That's the biggest way of prevention. Washing your hands after touching anything, or if you're sick, like blowing your nose, or before touching anything or putting food in your mouth, you should wash your hands before. That's the biggest way of prevention. Another way of preventing this illness is staying away from other people that are sick, or if you know that you're sick, stay home or wear a mask if you're going out to like the grocery store or something, so you can prevent other people from getting sick. Another way of prevention for a URI is getting the flu shot every year. This is another big thing. This can help prevent you from getting the virus. And then there also have been studies that show that people who take vitamin C prophylactically, even if they're not sick, helps reduce their chances of getting sick. So this is another thing that you can do. This is something you can just get over the counter that you don't need a prescription for. There's like gummies you can do. They have like little packets you can put in water as well. So this is another thing that you can do to prevent getting a URI. I also have more information on the chart on the right side, like exercising and getting a good amount of rest and eating a healthy diet can also help prevent getting the cold or a URI. So how do I manage my URI? It is a virus, so you do not need antibiotics. You can take acetaminophen and ibuprofen to help treat fevers, or if you're having any body aches or sore throat. You can do antihistamines and decongestant combinations like pseudoephedrine and Benadryl can help dry up any congestion that you're having. If you're having any congestion going in the back of your throat, which can be causing the sore throat, or just decongestants like the pseudoephedrine. You can also use ipratropium, which is also Atrovent. This can help with your cough. It'll help open up your lungs and help you breathe better and help lessen the cough that you're having. So why am I not getting antibiotics for a URI? So this is a viral illness, so it's not bacterial, so you do not need antibiotics. Antibiotics treat bacterial infections. Also, taking antibiotics if you don't need them can cause tolerance in your body, so it can also cause antibiotic resistance in the future whenever you need to take antibiotics for a bacterial infection. The very best treatment for URI is treating your symptoms. Like as before, what we talked about, taking the decongestants, the Tylenol, ibuprofen, all to treat your symptoms. That's the best way to treat a URI. So if you're using antibiotics to treat a URI, it can cause more harm to you in the future. You might need to stay in the hospital longer because you have to take a different kind of antibiotic, like an IV antibiotic, because now you're resistant to this antibiotic that could have treated your infection that you had. It can cause resistance to antibiotics, like we had talked about before. And then you will also have a higher risk of getting adverse effects uh, when you are taking antibiotics when you don't need to be taking antibiotics. Thank you for watching my presentation about URIs and why we do not use antibiotics to treat this viral illness. It is very important that we treat the upper respiratory infection by treating the symptoms that we're having and knowing when to give our patients antibiotics and knowing when to not give them antibiotics. That's it. Thanks.